Okay, this discussion is going to look at age and sex-related differences and their implications for resistance exercise. So we're going to be looking at just even looking at young children and maturity and looking at the appropriateness of resistance training exercise. Again, there's a lot of health benefits, even to we'd consider the non-athletic population to resistance training. We're just going to talk about some of the differences between how different ages and how between the genders. What are some slight differences as far as the adaptations that take place? So when we look at children and we kind of look at some of the issues as far as like physical maturity and things of that nature, we have to look at how that's gonna play a role with their physical activity. So with the growing interest in youth resistance training, it's important for individuals involved in strength and conditioning programs to understand growth, maturation, development. So first we're going to look at, when we talk about the growing child, we're going to look at two different time frames. So we look at childhood as being the time before secondary sex characteristics start to show up. So that's considered childhood. Adolescence is the time between childhood and adulthood. So that's when the secondary sex characteristics start to develop in young individuals. So that's kind of our initial kind of breakdown and kind of how we categorize younger individuals. Now, we also have to look at the difference between chronological versus biological age. So your chronological age is going to be your age in months or years. So that's just how old you are. Biological age is measured in terms of skeletal age, somatic, or we call physical maturity, and sexual maturation. Okay, so that's what we look at as far as biological age is considered. Okay, and for females, particularly, we look at the onset of menarche, or when they start to have their first menstrual cycle. And with males, we look at their secondary sex characteristics as ways to kind of determine biologically where they're at. So puberty refers to a period of time when the secondary sex characteristics develop and the child starts to get transformed into a young adult. Again, we kind of mentioned some of the markers that we have in order to determine that. During puberty, there's also going to be changes that occur in body composition and the performance skills. So it gets to be a delicate time, but certainly that doesn't mean that they can't. Obviously, young children can certainly participate in basic resistance training. But again, it's just a matter of how they get loaded and what you're kind of expecting them to do. So another thing we look at as far as being able to determine biological maturation, because as we said, in regards to what they can physically do, that's going to dictate, a lot about what younger individuals and how well they'll perform. The gold standard for biological maturation is skeletal age assessment. So basically what they do is they look at the skeleton and they look at the level of ossification that's taken place. An alternative to that, which you can also do, is again have secondary sex characteristics started to develop. Again, the most realistic for most just looks at somatic assessments, particularly growth charts. So growth charts look at peak height velocity. That's the age at maximal growth rate, during the pubertal growth spurt. So girls, that's usually around age 12. For boys, it's usually around age 14. So girls tend to hit that growth spurt a little bit earlier, so they tend to be a little bit taller, relatively speaking, compared to young boys. Another thing to consider when you're looking at whether or not they could train or what type of physical activities doing is look at their training age. Look at the length of time they've been consistently following a program. So that's something else that you could certainly consider. So children don't grow at a constant rate, and there's substantial inter-individual differences in physical development at any given chronological age. So again, you get individuals with growth spurts at certain times, but we've kind of gone through what are some of the basic characteristics we need to look at as far as being able to sort of categorize young individuals and where they're at maturity-wise. So again, looking at the growing child and looking at particularly muscle and bone growth. So muscle mass steadily increases throughout the developing years. During puberty, the increases in testosterone along with growth hormone and insulin-like growth factor in boys results in a marked increase in muscle mass. For girls, they obviously start to have increases in estrogen, which then, causes increase in body fat deposition, breast development, and widening of the hips. So there's certainly a much different physiological response when you hit puberty in young boys versus young girls, which is going to kind of influence how strength training is going to affect them differently. For both muscle growth related to hypertrophy, peak muscle mass tends to occur earlier in girls than in boys. So, boys have a tendency to kind of hit that peak a little bit later on and add muscle mass at a much more consistent rate later on than girls do. And again, that's just because of the consistent production of those anabolic hormones. When epiphyseal plates become completely ossified, your long bones stop growing. So you see in this illustration here, just kind of showing the changes in what goes on as the bones start to grow. You see in the fetus, they're primarily cartilaginous. So the blue kind of shaded area represents cartilage, and then the white area represents bone. You see in the young child, you have the growth plates present, and then as you get, as you get older, they ossify into the adult bone. So once the long bones stop growing, that pretty much, tells you that, for the most part, the growth has ended. Growth cartilage in children is located again at that epiphyseal plate. So the epiphyseal plate or the growth plate is kind of down here at the end of the long bones. The joint surface, and there's also what's called an apophyseal insertions. That's where some tendinous attachments will occur at that point. So damage to growth cartilage can impair growth. So again, with appropriate exercise technique, there's always this concern that the epiphyseal plates will just become damaged because of resistance training, and that's not true. You could certainly reduce the risk by, giving appropriate exercise, good progression, and then good exercise technique. Another important note, the diaphysis, which is the area of primary ossification, which is the shaft of the long bone, is another place of bone formation. So the epiphysis is the end of the bones, the diaphysis is the shaft. Again, girls tend to achieve full bone maturity before boys, about 2 to 3 years before, and most of your bones are fused by your early 20s. So that's pretty much when you definitively have the bones have all kind of fused and the cartilage has all turned into bone. Something that would cause ligament damage, so this is important from an injury perspective, why something that will cause ligament damage in an adult can cause damage to growth plates in children. So again, you'd experience some different injuries. So those of you that are in the rehabilitation and assessment part of injuries pre-AT, pre-PT, you can definitely see growth plate damage in individuals differently than you would as far as ligament damage in adults. Okay. It's important to also note that once the epiphyseal plate's completely ossified, just as we talked about, the long bones will stop growing. Okay, so as we look at growth and development in children, we're going a little bit further. So as far as developmental changes in muscular strength, so there's some important points to note here. So in boys, peak gains in strength typically occur a little after a year, after peak height velocity, and little less than a year after peak weight velocity. Whereas in girls, peak gains in strength typically also occur after peak height velocity. So similar to boys, the difference being is that there's a little bit more individual variation in the relationship of the strength to height and body weight in females, and some of that has to do particularly with the hormone differences between males and females and just body structure wise. So what this suggests when we're looking at both of these is that during periods of rapid growth, muscle increases first in mass and later in its ability to express force. So in other words, now we're not talking in regards to training, we're just looking as far as growth is concerned, because with training that changes a little bit. So just with regular development, during periods of rapid growth in both males and females, they tend to increase their muscle mass more and then later on develop the ability to express force. Another thing is that the strength of both males and females are usually pretty equal during pre-adolescence, so there's not a whole lot of differences as far as overall strength. However, there tends to be accelerated gains for boys during puberty versus a little bit more of a plateau in girls. And again, if you just think about what happens differently there, you have the testosterone increases in males and the estrogen increases in females. That's where that kind of comes into play. And then as we look kind of later on down the road, peak strength is usually attained by age 20 in untrained women. So again, we're talking right now, not necessarily what goes on with training. We're just talking about what goes on with strength, because obviously, even if you don't lift weights, your strength increases and your muscle mass increases as you get older. Peak strength is usually attained by age 20 in untrained women, and usually between 20 and 30 in untrained men. So again, because of testosterone being present, that allows for that continued increase in strength as individuals, even in males, as they get older. So the whole reason for the later ability to express force has to do with the maturity of the nervous system. So myelination of motor nerves tends to be incomplete until sexual maturation. Now, if you don't have as much of a firm grasp of the nervous system yet, myelination is the sheath on the nerve. So we have myelinated nerves in our nervous system. Well, even in the motor nerves that will have myelination, that myelination tends to be incomplete until sexual maturation. So that's part of the reason why that ability to express force tends to come on a little bit later. It's because that myelination hasn't. So what myelination does is it allows information to travel a little bit faster. So if that information travels a little bit faster, you get a little bit better, more efficient contraction of the muscle, which allows for that expression of force development. Now we look at body types. So there's 3 different types of body types. The early maturing individuals tend to be either a mesomorph build or an endomorph build. So a mesomorph build is kind of the individual with the broad shoulders, a little bit more muscular. An endomorphic build is someone who has a little bit more of a rounder shape. They have broader hips, tend to be a slightly higher body fat percentage. Whereas people who develop late tend to be more ectomorphic when they're younger. So an ectomorph is that tall, kind of slender build. And you usually see that in individuals, particularly those who are, kind of late as far as their physical maturation is concerned. And again, there's biomechanical issues associated with different body builds, and we kind of talked about this a little bit just in general when you look at strength training. So individuals, for instance, with shorter lever arms tend to be a little bit better as far as like their weight room exercises. So if you think about it, individuals with shorter arms tend to have a better advantage when it comes to pressing, because they tend to have a little bit of a thicker torso. Whereas individuals kind of, say, with long legs tend to have like disadvantages in exercises such as squatting, because again, their depth has to go a little bit more and their leverages are a little bit longer. So again, know the different types of body types. Again, the kind of early, the individuals who kind of tend to mature early tend to be either mesomorphic or endomorphic. Late matures tend to be more ectomorphic. And again, as they get to be adults, even adults will still kind of carry on these body types. These are just body types in general that kind of just describe how individuals are built. So now when we look specifically at children and resistance training. So again, resistance training for children is very safe. Again, we're going to give some guidelines as far as what you would do to keep it safe, to make sure that they don't damage any of their, again, we want to be conscious and aware of, the growth plates and things like that. But certainly children can carry on resistance training and it's healthy for them. So we're going to look at the responsiveness to resistance training. So strength gains have been seen in youth participating in resistance training programs. Training also, though, needs to progress as improvements will level off. So just like adults, children will adapt to what it is they're doing. So you always have to be kind of, progressing the program in an appropriate manner for them to continue to see changes. They can also go through detraining if they quit for extended periods of time. which can also be complicated by growth-related changes. So if they happen to take a really long time off and they have growth-related changes, that's going to impact their strength significantly because, again, their leverages are all going to change, plus just the detraining effect that occurs from not consistently strength training. So there needs to be continuous training to maintain strength gains. And most people agree that resistance training is safe. So it's not dangerous. It's actually a lot less dangerous if it's done appropriately than a lot of the things they actually do within sports nowadays, particularly individuals that play a single sport all year round and are constantly experiencing that continuous overload. Strength gains of roughly 30 to 40% are observed in untrained pre-adolescents who start a short-term resistance training program. So you definitely can get benefits there. The data tends to suggest that training-induced strength gains are impermanent and tend to return to untrained group control values during detraining. So that's just a fancy way of saying if they stop lifting weights, they're going to go through a detraining period. So again, just like adults, they have to continue at the very least to do some maintenance to make sure they're changing with this. Now, this is some of this information I'm going to talk about now is kind of important because this kind of talks about the adaptations that occur. So muscle hypertrophy changes in pre-adolescence with resistance training is not what increases strength. In other words, children, when they resistance train, aren't going to put on a lot of muscle mass. Part of that is because of a lack of circulating anabolic hormones. You will see strength gains, though. The strength gains that occur more because of a result of neural factors. So their nervous system, as a result of training and increased motor unit recruitment and firing, tends to improve their strength faster than muscle mass. So children who train will get stronger as a result of neural influence, not so much muscle mass increases, okay? The other thing, too, is it's improvement in a motor skill. If you have a young athlete doing an exercise, part of what's going to be their improvement is just the coordination. So say you have a young individual doing like a squatting exercise, doesn't matter what type of squatting exercise, just some type of loaded squat, they're going to get stronger just because they're going to get better at the movement. Okay, so we did talk about how in untrained individuals, just through the natural growth development, muscle mass will increase before strength development. However, when they train, the strength from the neural system will occur faster. Once they hit puberty, they'll start to get greater gains due to muscle hypertrophy. Now, for females, the anabolic hormones that are going to play a bigger role are growth hormone and insulin-like growth factor, primarily because females have significantly less testosterone than males do. And again, if you don't know why, go back to your endocrine system and look at where testosterone is primarily produced. So females do produce testosterone, but it's just a minimal amount. It's not as much as males do. So for females, growth hormone and insulin-like growth factor tend to play a larger role as far as that hypertrophy is concerned once they hit puberty. So here we look at some things associated with children and resistance training and potential benefits. So participation in youth resistance training can influence just many health and fitness related factors. One of the primary things is injury reduction. So one thing we're seeing with particularly a lot of the youth sports leagues is you're actually seeing an increase in injuries, and actually particularly chronic overuse injuries that you classically didn't see in young individuals. Part of that is because of the fact of maybe playing one sport all year round, never developing general physical qualities. But some of your potential benefits, again, injury reduction, improved motor skills and performance, psychosocial improvements. So just children get more confident when they're lifting weights. Decreased body fat, improvements in cardiac measures in obese children, and enhanced bone health. So those are all different things that you see as far as benefits for young children in resistance training. As far as risks and concerns, appropriately prescribed youth resistance training programs are safe. Again, where you're going to run into problems if you load them too quickly. Even 1 repetition max testing is safe. Now, it's only safe once the individual child has developed a base, they have good technique in the exercises, but once they experience that, you could start to consider 1 repetition max testing. Again, it's not going to be something that happens soon, but it is something that can occur. I mean, for the most part, as long as they're starting to develop a base. Again, you typically will start with unloaded movements and high repetition exercises, but there's little risk to having this if done appropriately. Some program considerations, some basic things to consider. Again, focus on skill improvement. So one of the things is, start to work them into movement patterns, squatting patterns, hip hinging patterns, pressing patterns, pulling patterns. You can do that, and that's going to help with that. Again, 1 repetition max testing with individuals has been done safely. Some people like to do 5 repetition max and 10 repetition max. They can be predictive, but they can also be dangerous. When you tend to do testing and you test things like 5 repetition maximum, 10 repetition maximum, and try to turn that into a 1 rep max, the issue is technique can break down if they become fatigued. So it's not as safe as a lot of people, tend to consider when they're doing this. So, make sure that you're, again, weighing it. I mean, you don't have to test. Strength testing for young individuals doesn't have to happen for a long way down the road. So even in regards to that, you don't have to worry about doing it. Again, use vertical jump and long jumping can also be a way to kind of predict where they're at. So you don't even necessarily have to load them. You could also do hand grip measurements. So you could use a hand grip dynamometer to test. That can give you a general idea as to their strength. So you do all that without even loading their structure with this. And also consider for teaching purposes using things like PVC pipe or training bars to teach exercises. Again, just teaching the movement patterns can mean that when they start to load them, they will get stronger a lot faster. So a discussion board question I'm going to have you answer. So I will post a discussion board post. I want you to answer this question. You could find some information in your textbook, but answer completely. How can we reduce the risk of overuse injuries in youth? And again, this is a problem that is becoming probably all too common in young individuals. So address this question. There's some points in your book. List them all. And then, again, some basic points, but could certainly be ways that we can look to reduce injuries in young children. So when we look at the development of muscular strength, you see this chart here talks about some different things that will contribute to the overall development that's going to occur in young individuals. So this is a kind of a theoretical interactive model for the integration of different factors related to the potential for muscular strength adaptations and performance. So if you notice this, pre-adolescent boys and girls can significantly improve their strength above and beyond growth and maturation with resistance training. So we know even without resistance training, both males and females are going to get stronger. However, when you resistance train, you're going to add to that. It's not until adolescence, though, it should show that hypertrophy is going to play a role. So if you kind of notice what goes on here, when you're talking individuals in training, so again, orientate yourself to what you look at. So neuromuscular performance, they're showing kind of the different levels of development. So you notice that natural myelination development, how that increases as a result of strength training. So notice we said that with someone who doesn't train, that's actually the thing that comes later. Whereas when they do train, that starts to have a greater influence. So for individuals that resistance train, their strength gains are going to be due more to motor development than they will be to actually seeing a benefit with the hormones. So that's an important point of emphasis with this, that when you talk about hypertrophy gains, it's not going to be what you're going to see initially early on with training. It's going to be more of that neural development.